Hello, everybody. It's attorney Laura Sterling. And how are you on this blistery cold day here in Florida? I know it's cold where you are because it's cold where I am. If it's cold in Florida, it's cold everywhere else. I spoke to my mother this morning. I think she said it's like 50 some below zero. Oh, I'm so glad I live in Florida and I'm complaining about 50 degrees. Anyway, I was so hoping and praying that I would have a big smile on my face today because Notre Dame would have won the college football playoff championship. They didn't, but they did an excellent job, and it almost brings tears to my eyes about how they've come so far in such a short amount of time. So I'm happy for them. I'm proud of them. They're a great team. As you may have seen on either TikTok or on Facebook, I posted some pictures from my trip to the Orange Bowl, which they won. And again, brought tears to my eyes to see them run out on the field. But they won the Orange Bowl trophy. I came home with the flu. So I've been down and out with the flu. Let me tell you, it hit me like a freight train. This flu is no joke. I still have it, if you can tell. I'm about to get some antibiotics and some cough syrup today to kind of help me get through this this second part of it so that I don't reoccur with this influenza A. But it's nothing to joke about. So take care of yourselves. Speaking of, I'm talking about Medicare today. Now, remember last live, I spoke about Medicaid. Medicaid is the state welfare program. It is a federal program run by the feds, but given to each state to put their own criteria, their income limit, their asset limit, couple asset, couple income limit, all of that. The state is able to set their own guidelines, but it's federal money. Medicare, I always have to do this with my clients because they get Medicare, Medicaid switched up. They talk about them like they're interchangeable. They're not. Medicaid is a state welfare program. You can qualify as long as your income and your assets are below a certain limit. Medicare is where you've worked a certain amount of units and you've paid into Medicare. If you're here in the United States, you see on your paycheck Medicare, and you're like, where is that money going? Right? Well, it's going into the kitty to feed everybody in the United States who's collecting Medicare. And hopefully, by the time you get there, there'll still be money in the kitty. So as long as you've worked those units, you qualify for Medicare. For example, let me give you an example. My husband, yes, he turned 65, 2 years ago, I think? I can't remember. Anyway, it's hard to keep up. And so, me being a recovering social worker, I thought, okay, we need to sit down. We need to apply for this Medicare. This is going to be a very complex situation here because I'm used to applying for Medicaid for clients, right? And that's a very in-depth, oh my gosh, you're giving blood, you're giving your right arm, everything. Medicare. So I sat down with my husband. We went on to the Medicare website. I just had to put in his information and submit. Okay. Do we just wait? I guess we wait. So we waited. And of course, I'm asking my husband, did you get the email? Did you get the email? Of course, my husband, he doesn't know where to look. He's like, email, what's that? Anyway, I said, let's go, let's look in the system. Let's look in the Medicare system. I hadn't looked in it. So I look in the system, boop, he was approved. I went, oh, look at that. That was so easy. And why was it easy? Because he had been working since he was 16 years old. So I think he paid enough credits in to where he automatically got Medicare. All we needed to do is put his name, his social, his date of birth, boop, he qualified. So now he's on Medicare. So I know people say they hear all this stuff about Medicare, Medicare A, Medicare B, Medicare C, Medicaid, Medicare D. It's like alphabet soup, right? How do you keep track of all the Medicares that are out there? Well, let me explain them to you. Medicare Part A is what my husband has. That's what you automatically get because you've worked enough units. Medicare Part A pays for hospital stays, pays for nursing home stays. Now, mind you, Medicare only pays as long as you're skilled. For example, you go into a nursing home for rehab. Believe me, it's changed so much since I've worked in nursing homes, but they now have rugs. You have to fit under those rug criterias and maintain that skill level for Medicare to continue to pay. Medicare will pay the first 20 days 100%. Any days after that, 21 to 100, there's a copay. So that's why people always have a co-insurance or something like that to pay the copay, or they apply for Medicaid as long as they qualify, remember, to pay that copay, or they pay it privately. But that's how it pays how it pays a skilled nursing facility. Used to be back in the day, Medicare would pay 100 days as long as they had a skill. And if skill could be where physical therapy still helping them walk, or they're still coughing, like I will forever and a day. But anyway, so that's Medicare Part A. That's Medicare, pays for hospital as long as you're skilled, in a nursing home as long as you're skilled. That's Medicare Part A. So think of that as a hospital benefit. So it's a hospital insurance, Part A. Part B is your medical insurance. What does that mean? Your medical insurance, it covers outpatient care, it covers doctor's services, preventative services, some home health care. That's what Medicare Part B is. And that requires a monthly premium. You have to pay for that. That's something extra. Can you believe it? I've been working since I was 15. I think I started working when I was 15, driving movie theater. So much fun. Anyway, but since the age of 15 and now what? I'm 20. Just kidding. But I've been working for many, 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 many years. And to think that, gee, I should get Medicare in my pocket free of charge, right? No. Medicare Part B requires a premium. It's your medical insurance. It's saying, hey, I have a copay. Hey, I have to go see a doctor. I don't need hospitalization. I just need a doctor. Think of it as Part A as your hospital insurance, as that catastrophic. Something catastrophic has happened to you and you've paid in, so you don't have to worry about it as long as you're staying in that skill. Medicare is just like Medicare Part B is your medical insurance, just like Blue Cross Blue Shield, Aetna, Humana, whatever it may be. You have that, and that just covers the preventative stuff. So you have to pay a premium for that. Then the next part of the alphabet, Part C. Part C is your Medicare Advantage plan. Oh my gosh, right? It's like ringing in your ears. You hear it every day. If you're home watching TV during the day, what is it? Joe Namath. I think it's Joe Namath, isn't it? JJ Walker. All those people that were young when I was growing up are now older, and they're older than me. I just want to point out they are older than me. Not by much, but they are. And they're always talking about these Medicare Advantage plans. There is a time frame to sign up for these Medicare Advantage plans. And they are offered by private companies approved by Medicare. So can be Blue Cross Blue Shield or Aetna or something that's offering it, but approved by Medicare. So you see the advertisement, Joe Namath talking about you get this, you get that, or JJ Walker talking about this, talking about that. And what it does is it combines Part A and B, the hospital insurance and the medical insurance together, and includes additional benefits like dental, vision, prescription drug coverage, all kind of in there. It's kind of an all-encompassing kind of Medicare. So Medicare Part C, you could say, I always do acronyms. Part A, I had something catastrophic. That is A number one. B, I want to do some preventative. So that's kind of lower on the totem pole. So that's Part B. Part C is coverage for everything. So it's an advantage plan. Again, there's going to be a premium for that. Understand that Part C, there is a premium if you want to get that. Knowing that Medicare doesn't really cover dental or anything like that. And if you want to continue that process, you can pick up Medicare Part C. Now, the last one is the one that I need right now. Part D. This one's easy to remember. D, drugs, D. Medicare Part D covers prescription drugs. So it covers the cost of your prescription drugs, what I just had to take, Tamiflu. That thing was $50. I don't know if they gave me a discount or anything, but apparently my insurance didn't take it at the drugstore that I was at. And of course I was like deaf, like I was dying. And they're like, well, we don't take it, but you can go across the street and we can go. I don't want to go anywhere. I want to go home and go to bed. give me my prescription drug. I'll pay the $50. I'll be on my way. So the Tamiflu that I needed, the antibiotic I'm about to take, the cough syrup I'm about to take, and I'm very picky about my cough syrup because I have a severe allergy to codeine. So me and cough syrup have to have a relationship first before I take any. But that's what that's what Part D is, prescription drug coverage. You probably hear a lot about it on TV. There's a lot of commercials. Usually the commercials are towards the end of the year when that open enrollment is for the Advantage program and the prescription drug coverage. So you see a lot of those commercials. If you're home during the day and you happen to have the TV on, you're going to see them ad nauseum. So that is what C and D. C and D are kind of that extra. A and B are probably the most important just because A is catastrophic. This is A number one. You've fallen and fractured your hip. You've fallen and broken your arm. You've had a TBI, traumatic brain injury. You need to go into the hospital. You need to go into rehab. That is A number one. Part A. That's what you've paid for all these many, many, many years. Part B, your medical insurance. What's going to cover outpatient care? What's going to cover doctor services? What's going to cover preventative services? That's your health insurance. You have to pay a premium. Then you've got Part C, coverage. That Medicare Advantage plan has that coverage. It covers dental, covers vision, coverage, complete coverage. If you want that, again, a premium. And then, of course, D, like I said, is the prescription drugs. D for drugs, drugs for D. So Part D is that prescription drug, and it requires enrollment in a Medicare-approved drug plan and also has a separate premium. Everything is separate. You're forking it out. What it is, I don't know. That really depends on what insurance company you go through, what plan you go through, what you want coverage for, what you don't want coverage for. The nice thing is my parents, their generation, they had available to them long-term care insurance. They had all kinds of different things that were very inexpensive way back in the day that aren't even offered today. So if you can find a long-term care plan that is inexpensive, good luck. But if you can, it's always a good idea to have it to kind of cover that so you're not left without any money, so that you have that plan there and it's there for you. Your best thing is to contact your insurance carrier if you have one, Blue Cross Blue Shield, whatever it may be. I don't advertise anyone. I'm just throwing names out there for you so that you can become more familiar with how Medicare works. Remember, this is the Medicare plan. This is what you've paid into all your life. Medicaid, anybody can qualify for that as long as they fit the income and asset limit. Medicare, you've had to pay in and you've had to work in a certain number of units, air quote years, to qualify for that Medicare. So understand that they're two separate and distinct bodies. So remember, Medicaid, that is the public assistance program run by the feds, but each state can set their own limits. Medicare is what you pay into, and you have to work a number of units, number of years to qualify for Medicare. A, B, C, D. It's like the alphabet, an acronym. Keep it in your mind. Again, I'm attorney Laura Sterling. I'm so glad you joined me, and I'm so sorry I'm under the weather. I feel like my voice is like going to give out at any moment now. So again, make sure if you have any questions or anything that you need from us, we're here from you. Again, I'm in the state of Florida. If you have any questions and you're outside the state of Florida, make sure you get with an attorney in your state or your country. Otherwise, we're here for you in the state of Florida. And go Irish.